Imagine trying to navigate a maze blindfolded. That's what the new federal health bill is doing to Covered California, the lifeline for nearly 2 million Californians seeking affordable health insurance. This legislation isn't just tweaking the system. It's actively working to make it more difficult for people to get the coverage they desperately need. Let's dive into the specifics and see how this bill will impact the Golden State's health insurance marketplace. First, let's talk about who relies on Covered California. We're talking about a diverse group of hardworking individuals, including landscapers, caregivers, hairdressers, truckers, and freelancers who don't have employer-provided insurance. It's also a crucial resource for middle-class folks like real estate agents, small business owners, early retirees, and those between jobs. For entrepreneurs just starting out, Covered California is often the only way to get health coverage for themselves and their employees. But here's where it gets controversial. The new law is set to make their lives much harder. The new legislation introduces several significant hurdles designed to discourage enrollment. One of the most glaring issues is the shortened enrollment period. Starting next year, the time to enroll in coverage or switch health plans will be reduced by a month. A month might not seem like much, but it translates to longer wait times for assistance and increased confusion as everyone rushes to apply at the last minute. But this is the part most people miss. The reduced enrollment period isn't just about convenience. It's about creating barriers. Another major change is the elimination of the low-income special enrollment period. Under the previous Affordable Care Act rules, individuals with incomes below 150% of the federal poverty level could enroll year-round and receive premium tax credits and cost-sharing reductions. This means someone earning no more than $23,475 a year could get help with their health insurance costs. The new law scraps these subsidies for those who enroll through special enrollment periods regardless of income. So, if you miss the regular open enrollment window, you're out of luck and will have to pay the full premium and out-of-pocket costs. Think about the single mom working 2 jobs just to make ends meet. Now, she has to navigate this bureaucratic nightmare just to get basic health care. And this is the part most people miss. The new law creates mountains of red tape. Starting in 2028, new applicants will need to provide proof of eligibility because marketplaces can't rely solely on third-party data sources. Consumers will have to verify and submit information about their household income, family size, immigration status, eligibility for other coverage, place of residence, and any other details the Department of Treasury deems necessary. Automatic re-enrollment will also end by the end of 2027. If there's a data matching issue, applicants will have to resolve it manually, a process that can take months. More than half of income-related data matching issues take over 60 days to resolve. Imagine the stress and uncertainty for someone who just needs to see a doctor. The new law also prohibits many lawfully present immigrant groups from receiving financial assistance. As of August 2025, recipients of the Deferred Action for Childhood Arrivals program, victims of human trafficking and domestic violence, and refugees with asylum or temporary protected status will lose their subsidies. This will likely force thousands of individuals to discontinue their enrollment, leaving them without access to critical preventive and primary care. But here's a thought-provoking question. Is it fair to punish these vulnerable groups for circumstances beyond their control? The new legislation also fails to renew the enhanced premium tax credits, which made health insurance more affordable for eligible applicants. According to estimates from KFF, Health insurance premiums for ACA enrollees could rise by more than 75%, with 90% of the more than 24 million Americans who signed up for insurance through the marketplace receiving a subsidy. Losing this support will make health coverage unaffordable for many. Health insurance is already complicated enough. Why make it harder for people to get the care they need and deserve? If a state knows someone is eligible for tax credits, why make them fill out paperwork to tell states what they already know? Why force new parents with low incomes to wait for their child's Social Security card to arrive to cover their child, or pay hundreds of dollars up front for the coverage that newborns especially need? Part of the problem is that lawmakers are relying on the complexity of the new rules to make people give up buying coverage through the marketplace. The Nonpartisan Congressional Budget Office estimates that when combining the law's effects with the expected expiration of the ACA's enhanced premium tax credits, 16 million more people will be uninsured in 2034 than would otherwise be the case. In California, 1.8 million people may be uninsured by the combined effects. Californians deserve a healthcare system that works for them, not one that pushes them out with bureaucratic burdens and budget games. These are people building better lives for their families. They need our support, not more red tape. So what do you think? Is this new legislation a step forward or a step backward for healthcare in California? Share your thoughts in the comments below. Let's spark a conversation and see where the chips fall.